So, Anna, could you please tell us what barriers you think mothers face when trying to access mental health support?
Um, okay, I think first might be the availability, um, depending on the location and also the cost. Um, I think also going through just the regular way, people often have to wait long waits before they can get in. For the appointment, which is at least what happens in Croatia, because it is very overbooked and there is not enough professionals in this field. Um, I think also stigma is a big part. I think it did get better, of course, during or after COVID. But I think, especially for people that are from this part of Europe, after everything that happened with war, I think people are often very um, tough to just saying, you all are softies. Back in the day, we went through the war. You're all so sensitive. Everything gets to you guys. Like, I think that is just the way that people are brought. And I think our generation might be a bit better, but I think say our mom's generations that lived through war, I think they are maybe saying this to themselves too. And I think also just the awareness. I don't think that you know depending on the severity of the mental health issues, I think a lot of time people are not aware of their troubles, which is just something that's um, a normal thing. But that's when the surroundings need to help them recognize and deal with first acceptance that they need help, and then knowing that they can and they deserve to get help, which then can only lead to them wanting it for themselves. Um, yeah, I think that would be the barriers that I can think of.
When mothers suffer from specific discriminations induced by cultural stereotype, social expectations, sometimes based on someone's social economic status. So, how do you think early intervention in mothers' mental health could possibly reduce these barriers and empower mothers?
Mm. Well, I think generally it's very known that early interventions in anything um, is the best way to to tackle the subject and the problem. So I definitely think, that um, the early intervention is very needed. And I think that this also comes, you know, that's where all everything that we said before about the society itself and the professionals that are in care of mom and the kid at the hospital can help, because I think that everyone goes through a bit of training about certain topics. So I think that even just the nurses that are taking care of the mom after or post birth are also very important when it comes to just recognizing the way that mom is dealing with certain stress, and just being able to give them certain advices, or even like to maybe just if they recognize something major, to just instruct them on where to ask for help. And I think um, then, just with them then having that in their mind before something happens, that can tackle all these things, because when they already know this straight from the beginning, I think it's more unlikely that it's gonna get triggered or they're gonna get moved far from it because of people saying certain things, because I think then they will be able to just recognize that as it is without the extra things coming in.
Actually mentioned something earlier, which I think was great. You said that when you give money, you invest more in yourself. People invest more in themselves. Could you expand a bit on what you meant by this?
Yeah, I think I always mention gym, but I think nowadays people really are investing a lot of money in how they look, and how they feel in their own body. And I think that just as a big part of our life is that we are physical beings, but we are also emotional. And we have this big brain of ours that is very complex. And I think, muscle is a lot less complex than a brain is. So I think it just shows that, we are everyone to each to their own extent, but everyone is willing to invest in themselves when they know that this is something that benefits them. So I think that seeing a mental health just as a physical health can help us recognize how important it is to be strong in our mind, and how important it is to take time and invest all the resources that we would in a physical sense for this, because this might be even more important. And I think when you're mentally strong, even when you're physically not as strong, it is a lot easier to deal than when you're just mentally not strong, and you can be physically as strong as you want, but something is still gonna be inside and it's gonna interrupt you in everything that you do. So I think that people are willing to invest in what they think benefits them, but I don't think we are yet aware of just how much we can actually change our own state of mind, and how this is something that we actually want. We just don't know.
So, Anna, during your time at SOS Children's Village, Croatia, what was an important resource that made you feel supported and empowered?
For me, personally, it would have to be my SOS mother, Marica, which I have grown really close to, and I kind of just call her mom now. And I think just the idea the SOS has you know, of this small house of 5 to 7 kids living with one SOS mom that basically just lives with you as you were their own children, is, I think, the best place I could have ended up in, because that is exactly what um, the kids that have this life that they were forced to have because of their circumstances. But I think, this is what made me actually a person equipped to live a life, and to just to learn what love means and how to love and how to feel loved. And um, it definitely gave me a better chance in life. So I'm very thankful to my mom. And I think out of all the other institutions I've been to and seen or heard about, I really believe that the idea that SOS has of it being a family structure is exactly what is missing to the kids. So definitely for me, that would be the main one.
And how did this experience and your SOS mother, How do you think this shaped your perception of the role of a mother and the support that mothers give?
Yeah, I think she was a very a loving person, and she was very just, and for me growing up it was very weird to see how she was just like so selfless to someone that she doesn't even know. And she had 25 different kids coming in through the house that basically she raised, and she was just like so, just dedicated to us. And every single day, whole day was revolving around us, and she was just doing these small things that I will never forget, such as like putting the potato slices in our feet when we were having fever, to bring the fever down. And she would just wake up at random hours in the morning at like 2 a.m. and just do these things. And like she was very very dedicated, and like she was really trying. And I think a lot of times when she would make normal mistakes or yell or anything, but I think she was very open, and we would see her get really really annoyed with us, but then she would cry afterwards, and she would always say sorry if she overreacted. And I think it just showed the human side to a mothership, that sometimes you just don't have the answers, and you don't have any idea how to deal with a certain situation, but you just try very, very hard and you give your all. And I think this is exactly what any mom does for their kid. So I'm really grateful that she did that for me, to make me feel like I was her own.
And based on your experience, what sign did you notice in children that haven't received adequate mental health support?
I think there's like these things such as like withdrawal, like from life, and I think from just being scared of risking getting hurt and going in even just any friendship. Um, and I think that might be the biggest one. And of course, the lack of awareness of their own feelings, and where they are in life, what they want, just the lack of, just love for themselves, and, just lack of knowing that they deserve a place, they deserve to take to take space in this world, um, which is very saddening, I think. Just not knowing that you were born for a reason, and that you get to have, you know, just a normal life, um, is very saddening. Uh, from I think different ones, definitely done. I think I found generally, not even just in kids that grew up in institutional care, but just in general, I think nowadays a problem is that people are not really um, taking time with themselves. A lot of time they don't even know, what they want, or what they don't have their own boundaries. Um, and a lot of times that means they are willing to just go, 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 and let people break their boundaries, which they don't put, but like go into their personal space and hurt them. And then like they just, after a lot of times of this happening over time, it just causes them to create the insane amount of pressure on themselves and anxiety. And I think that people generally are not taught today that, they deserve love, they deserve to have a voice on what is allowed to be happening in their life and what isn't, what they can, they can ask for the space, whichever that means, because, everyone comes with their own character. Um, I think these might be the biggest ones. But I think also just the lack of true connection. I think that not having the connections in life in when it really matters in the early years really in a way uh, just makes people not even know how to create one, not even know that they need one. And I think that oftentimes this just they kind of bring on themselves this isolation. And I think we all do it to a certain extent. I think even me being this open and, you know, loud person, I think I created this idea in my head what it means to be strong. And I was using this for 24 years. And in all this time, I, you know, didn't have didn't take time to talk to people to ask for their advice, and I didn't even allow other people to actually feel like they knew me. Like they always thought when I came back, they were like, oh, we didn't know you had any problems, we thought, you just don't have any problems. And I'm like, whoa, is this how far I took you guys? Like I took myself to believe, to make you guys believe that I don't struggle. I think everyone struggles. But I think, yeah, just not being open with themselves, which then enables it definitely disables people from being able to be open to each other. And I think when that's what brings about the the trust. It is when people feel safe uh, with one another. But I think if you're not able to say anything that's meaningful to you, then other people don't think you trust them. They don't feel safe around you to share their own things. So yeah, I think these are the main ones.
Does investing in mothers and in children mean to you? What benefit might it have for families in similar situations to yours?
Yeah, definitely. I think it, that's kind of like the early intervention, because if we start investing um, early, then there's not going to be any need for the separation, which is literally the worst case for both mothers, also fathers and children. Um, and I think there is no extra things that need to be said there because the last resort should be the separation. But I think oftentimes um, we go straight to that because there is just not enough of a system that's being um, developed in such a way where you could have different degrees, when you can have different support teams.